Hello, welcome to the June board summary. My name's Jonathan Higman, I'm the Chief Executive here at Yeovil Hospital. We started the board meeting as usual with a patient story, and this month our focus was slightly different. Sarah Palmer, who's the paediatric sister in the emergency department, came and talked to us about the support that she had received and the department had received from the League of Friends. The League of Friends raise around about £140,000 a year, both through the shop and through their other activities. And Sarah talked about the developments that they've supported in ED, the major improvement to the resus area within ED, and the work to improve facilities for children across the trust. It was really clear what a phenomenal impact the League of Friends have on the hospital, and their fundraising efforts and activities is so well valued by us. We then moved on to hear about an operational update on the hospital. We've managed to maintain our good performance both in ED and RTT through the month. We're now planning to get EAU back following the floor replacement there, and that's due to happen next weekend, so over the weekend of the 13th of July. This section also focused on our plans for winter of next year, which seemed very strange given the temperature outside, but we heard about the key plans in the key elements of the winter plan. The things that are going on around expanding the frail older persons assessment service, and again you may have seen the building work starting to happen in the old contact centre on level 3, which is part of the enablers for the new FOPAS. We also had plans around how we expand our therapy service to cover 7 days a week, and also a plan to open in a planned way the Jasmine beds as escalation beds over the winter period, to support also a change in our profile of elective operating, particularly over the Christmas period and early into the new year. We had an update on the current situation with visas. I think this has been an ongoing area of discussion, and you'll know that we were part of a consortium trying to put some pressure nationally on the government to change the visa rules, and I'm not saying as a result of that, but as a result of pressure from many areas, the government have reconsidered that, and doctors and nurses are now going to be excluded from the national visa cap, so there'll be no future restrictions. For us at YDH, that means that there are 5 SHO posts in medicine and orthopaedics, which we're expected to have released as a result of that, so it's really, really good news. Our performance focus for this month was on the Cancer 62-day standard, where we have got some pressures at the moment, and Kerry White, our Deputy Director of Operations, presented the action plan to improve performance against that standard. We noted that about 50% of the breaches are within our gift to influence, either through streamlining clinical pathways or improving our processes of tracking and management of patients on their clinical pathways. So over the next few months we'll be interested to see progress with that action plan, and hopefully an improvement in performance around the 62-day standard. There's always a variability with this because of the relatively small numbers of patients that we see, and I think one of the really striking statistics was that although we're seeing around about 600 patients a month being referred into the hospital on a 2-week wait pathway, subsequently only about 8 to 9% of those patients have a positive diagnosis of cancer and go on to be part of that 62-day pathway. So part of our challenge is to work with colleagues in primary care to improve our referral processes and streamline that part of the pathway. Tim Newman, our Chief Finance Officer, then gave an update on our financial plan for 2018-19. We've agreed a control total with our regulators and the Somerset system, which is a deficit position of £19.8 million for this year. And that would represent an improvement on last year's outturn, and would also give us access to just over £3 million worth of additional funding should we be able to hit that number. To do that, we have to hit a CIP, deliver a CIP, cost improvement programme of about £7 million, so still a really challenging number. We are working more closely with the Somerset system, as I've said before, to manage this more collectively across Somerset. And for us this year, it means a move back to a block contract arrangement, but with a budget uplift to reflect the costs of the additional developments that we want to put in place to support winter, and a quarterly review process. So if our actual activity is significantly higher than we'd planned, then we will have the opportunity to go back to the Somerset system and the CCG to talk about how we mitigate that, or potentially receive some additional income. We finished a formal board meeting at that point, and then we moved on to have our annual update with the junior doctors, where we reviewed their quality improvement projects. And again, we did this as a cafe style session, hearing really quickly from the four projects and the four groups of junior doctors about the work that they've been doing around quality improvement, which is focused in a whole number of areas around prescribing, ordering of tests, and their training programme. It was, as always, it's a really enlightening session, and was fast paced, and we had an awful lot about the work that they have been doing. For me, I think the question is how we can roll and spread this QI methodology across the organisation into all sorts of different areas, because it's really obvious that it's a great way of engaging people in making rapid change to their services. So we wanted to support both the junior doctors in the next round of that work, but also think about how we can roll that out more broadly across the hospital. Hello, just in case you haven't noticed, this week the NHS turned 70, and I just wanted to mark that by saying a few things. One was just to give you a bit of an update on all the various celebrations that have been going on over the course of the last week. But I think firstly, just to say a big thank you to all of our staff, to everybody who works so hard, so diligently to provide such amazing care to our patients. I get very, very regular correspondence directly from patients' families and relatives about the great work that we do here at YDH. It makes me really proud to be part of the NHS. We've clearly been doing an awful lot this week to celebrate the 70th birthday of the NHS, and just in case you haven't caught all of the things, I'll just give you a bit of a flavour. We had yesterday BBC Radio Somerset with us for most of the morning, doing their breakfast show live from the outpatient department, and we heard from a number of members of staff during that outside broadcast about the work that they do here at YDH. And this morning that's also been repeated, or there's a further session this morning in the maternity unit, where the mother of a newborn baby, the first baby to be born on the morning of the 70th anniversary, was interviewed. So some really good stuff there. We've also had the ongoing set of internal films for staff, which again I've been watching each evening to see A, who's there, but B, to hear their stories. And again, it provides a real flavour of the cross-section of staff that work here at YDH. We had our famous bake-off on Monday, and I was again pleased to be part of the judging panel with Val from the bake-off, and learnt a huge amount from her about what makes a good lemon tart. We've also yesterday had our fairground games as part of the day's celebration around the birthday. I attended the national event at Westminster Abbey, and the chairman went to York Minster to the second national event. We both went along with some of our longest serving staff and volunteers, and again it was amazing to hear all of their stories during the course of the day, and also some of the national stories that came out as part of that. We heard, certainly at the Westminster Abbey session, a very, very moving story from a young girl who had been caught up in the Manchester bombing last year, and the amazing care that she'd received at Manchester Children's Hospital over the last year. And then finally, also some great publicity in the I newspaper yesterday, an article with Gemma Purlis and Sheila Meldrum talking about the work that we've been doing to recruit nursing staff from overseas. So that was a kind of really great piece in the I, probably still available online. And finally, just a little plug. Next Wednesday, we have our local service of celebration at St John's Church in Yeovil from 6 till 7 p.m. So I'd really encourage you to come along to that. I'm sure for a number of people it will depend on what happens on Saturday with England and the World Cup. But please do join us if you can for that session. Thanks very much, and thanks once again for all the amazing work that you do here at YDH and across the local health system.